The variants of the COVID-19 virus showing up in Colorado are not a surprise. They do give us an idea of how long the virus is going to be part of our lives around here. Let's dive right in tonight with this from Anusha Roy.
So far, the state has detected nearly 60 COVID variant cases.
In Colorado, have not seen any sort of significant growth in one of these variants causing disease in the state.
The state says the vaccines offer protection against the strains found in Colorado so far, and health experts say they expected these variants to show up.
Naturally copies itself. It's like handwriting, and so it's literally printing it out. At some point, it'll make a mistake, and the 100th time it copies itself, that mistake just gets perpetuated, and sometimes that's meaningful and sometimes it's not.
The virus has to become more creative in order to continue to propagate it.
Before we go any further, doctors want to get one thing really clear.
Vaccine has more than zero. So even if they're not perfect against these variants, it still seems to allow some level of protection.
The state said it would be most concerned if variants chipped away at the vaccine effectiveness and kept infecting people.
We really aren't seeing that right now with the B.1.1.7 variant. There has been some of those concerns with some of the other variants that are circulating across the globe, specifically the variant that has been causing and identified in South Africa, and also a variant that has been identified in Brazil. But at this point, those variants have not been identified in Colorado.
This is so important as we look to the future.
It tells us that COVID is something that we'll probably be living with for many, many years to come. Obviously, the hope is that the degree of infection that it causes over time will lessen, and then with the impact of vaccine, it'll become sort of in the background.
Now that variants are here,
and I think that is yet to be determined, but it would not surprise me if in the fall we're talking about boosting or vaccinating with a newer version of the vaccine.
So I just want to touch on that last point real quickly, that Dr. Barron is saying from her vantage point as an infectious disease specialist, a booster shot or a vaccine that's a little bit tweaked, it's already on her radar just to keep up with COVID-19 and what's happening with it. It is why her, and along with every other doctor I talked to today, said once again, this is why it is so important for people to just keep up their COVID precautions and not let their guard down.
Anusha, it feels like the virus started mutating like as soon as we got our hands around it. Is that typical?
Yeah, okay, so I asked that exact same question because I was feeling the same way, right? Every virus is going to have its own timeline, and Dr. Barron said what happened with this particular virus is actually kind of what she expected, but everybody's sense of time is just weird over the last year, but also we've had researchers around the globe all focus on the exact same thing, Kyle, and then it's just been pumping out information. So it's a lot for people to keep up with.
This conversation reminded me of a viewer email from a woman named Diane Wright. I actually pulled it up during your story. Diane Wright was wondering whatever happened to the 1918 pandemic flu. I looked this up earlier in the week. So Diane, and for anybody else that's interested, that flu just kind of mutated and parts of it are still around, scientists say, to this day. Anusha, thank you so much.